And now joining me on the phone is Minister Christine Elliot. And thank you very much. I really appreciate you taking the time for doing this today.
Oh, thank you for having me join you, James. Thank you.
So, Minister Elliot, the one thing I do want to talk to you about off the top here is the updates to the long-term care home plan that were announced by Premier Ford today. Can you kind of, first of all, just break down how the province is going to be dealing with the long-term care homes now?
Well, we know that there is a problem in our long-term care homes, that there have been a number of outbreaks of COVID-19. This is a very vulnerable population, so we've heard several of the public health experts say that we need to bring an iron band around them. So what we're trying to do is further protect them, to make sure that we test all residents of long-term care homes where there has been an outbreak, and we're also going to conduct some testing in places where there have not been any outbreaks, so that we understand a little bit better about how it does advance. So we want to make sure that we can do more testing. We also want to make sure that we can bring in more people to work in long-term care homes, whether that's from home and community care sector or the hospital sector. We know that they need more assistance, and we need to make sure that we have the best education available for staff on the use of personal protective equipment. They are all now going to be required to wear surgical masks throughout their shifts. So we need to give them some more education on proper use of this, and also proper cleaning and other protocols.
So, Minister, there's some discussion here that, there has been an issue in long-term care homes in Ontario for quite a while, and there's been calls for change. What at this point now will you be looking at doing to bring these changes to these long-term care homes and deal with issues like this, because we could see COVID-19 swing back around again in the next season?
Well, yes, and unfortunately what is happening in Ontario is happening elsewhere across Canada and throughout the world. But I think that just this experience with COVID-19 has given us some specific insights into concerns. One is the fact that there are a number of people who are working at 2 or 3, perhaps, long-term care homes or retirement homes, other homes of congregate living. And so now there is a requirement that they only work at one location. That will be really important for infection control going forward. Even though this is a temporary measure, it is something that I think that we need to examine in greater detail once we've gone through the pandemic.
Will there be an opportunity to look at salaries for PSWs? Because I know that has been an issue in terms of why they're working at multiple homes.
Well, I know that it has been a financial problem for a number of people. That is why they have had to take work in a number of homes. But what we're hoping to solidify is that they may be able to receive the hours that they need in only one location. So that is something that that we do need to take a look at going forward, and to make sure that that they are able to make a living doing that work in one place.
I just want to stick on the long-term care homes for another sec here, and just ask you now, the question came yesterday that whether long-term care homes were all getting the necessary PPE equipment that has been pulled into the province. Is that a situation that's happening now, or are we seeing this spread of equipment evenly out throughout these homes?
Absolutely, yes. This is something that we, throughout the course of the weekend, since the order was made, this has been distributed throughout the province with homes, and we actually yesterday we received another 7 million surgical masks that are, as soon as they come to us, they are being distributed because we know that people need them.
Fantastic. So switching now to the testing. There's been some discussion about these blood tests, having a faster, test rate. And the province has been looking at, pushing up its testing rates as well. Is there any chance Ontario could be looking at using these quicker tests anytime soon?
Absolutely, yes. We are looking at boosting our testing. We by tomorrow, so for the full day of April 15th, We expect to be at 8,000 tests per day. That is what the goal that we were aiming for, and then of course we're going to continue to multiply those tests afterwards. But yes, we are looking at some of those tests that have a shorter time frame for receiving the diagnosis, yes or no, for COVID-19. We have entered into an agreement with Spartan Pharmaceuticals. They have just had their test to be approved by Health Canada, and we anticipate that those tests will be very helpful for uses in some of the fly-in communities, some of the First Nations fly-in communities, and some of the other areas in northwestern, northeastern Ontario, where it's difficult to ship the traditional test samples to labs to be analyzed. So I think we will be relying more on those types of tests, but we'll still use the regular tests as well.
Now, Minister, there's always been this discussion about the surge coming to Ontario and the surge in Canada. We really haven't seen a surge yet. Is there a possibility that we may have avoided that because we're starting to see a flattening of the curve?
Well, I think it's a little early to say that yet. We can't, this is not a time for any of us to sit back and become complacent because we don't know what's around the corner. But I would say that some of the measures that were put into place very early on, restricting groups of people, asking people to stay home, making sure that, if you need to go out, just go out for food or medication. I think that has had an influence, but we're far from being through this yet.
All right, Minister, I have one last question for you, and I did ask the Premier this. I'm going to ask you this as well. How are you doing personally?
I'm doing well, thank you. I am just so thankful to the people of Ontario, and especially to our frontline healthcare providers they're the real heroes in this, going to work each and every day. And our job is to make sure that they have the personal protective equipment and that they need, as well as the ventilators and hospital space. So that's what we're spending all of our time on. But I think that it's really important that everybody continue doing the work that they're doing. We have asked people not to travel to their recreational properties, to stay in their own home communities, because I know that that's difficult for some smaller communities that do have a lot of vacation properties within them to provide sort of basic supplies, not to mention hospital and health supplies. So we will continue to voice that message, but the people have been great in following the directives and so on that have been put forward by the Chief Medical Officer of Health, and of course we're going to continue to abide by his direction as well.
All right, Deputy Premier and Minister of Health for Ontario, Christine Elliot, thank you very much for taking the time.